Hello viewers, welcome to Health Profile. Today Dr. Jyoti Chabria is with us. Hi ma'am.
Hi Kritika.
How are you ma'am?
Great.
Ma'am, what kind of problems they suffer when they have vitamin D deficiency?
This is a very good question that you've asked, and it's good because people will want to know. And vitamin D3 affects, a deficiency of vitamin D3 affects every part. It could be skin, hair, fertility, weight gain, weight loss.
It's also linked with the fertility.
Absolutely, even depression. So it is so important that your D3 and B12, because it's
Playing
all
a major role.
Absolutely, because it's absolutely, it's all about circulation, and the whole body is nothing but circulation. So even a hormonal imbalance like a polycystic ovary or infertility, these are all linked to D3 as well. Like sperm counts, especially if you have a low D3, you find a lot of patients with a low sperm count or a motility which is low, and it gets rectified if you take the right supplements.
Ma'am, what are the main causes of overweight?
Well, there are several causes of overweight. Especially in children, when now with these advertisements that are all over the TV, the child gets attracted to the little toys, yes, or the little games that are given as add-ons to the product. So these children get so lured by those little gimmicks that the companies are using for marketing, that they insist that the parents buy it, and the parents end up doing that. That's one reason. Secondly, especially amongst children, what we see is that both parents are working nowadays. No one has really time, so they just give you the tab or something and sit.
They'll just leave.
Just leave you to either do that, or yes, they end up with all these apps coming in where it's supplying food to you at home. I mean, half the people are not eating home cooked food because they prefer to eat from various restaurants. So that is unhealthy habits. These are unhealthy habits which lead to obesity and indulging in a lot of junk food. Where do children go out to play nowadays? Where do adults go out to play a sport today? Everyone's either on the WhatsApp or the phones, or they're on a Netflix or something like that.
Or online games.
Exactly. So no one's really going out to exercise also. So obviously when you don't have exercise or you don't eat right, and of course sleep is another factor that we see all the time. Yeah. Nowadays, I mean, the number of patients who come to us and say they are not able to sleep, especially in this COVID or yes, this pandemic time. I have actually made a product for sleep.
Okay.
Which is like an inhaler with essential oils, okay, like lavender and other things.
So how those will help them, ma'am?
These are like a snooze. It's called snooze, where you just inhale it, and in 15 to 20 minutes, it is seen to calm down people, and they're able to.
Is it safe, ma'am?
Absolutely, because these are all essential oils, and it's an external thing. You're not, So this is what I've seen very rampantly in the COVID. People are unable to sleep. But really speaking, to keep your weight under check, there are a couple of things that you need to do. One is, of course, a balanced diet. You need to exercise. You need to sleep adequately. Okay. And you need to have less stress. Now, you will not believe, every day I meet some patient from a corporate who tells me that, madam, and they are actually going through depression. Why? Because they are not able to get out of they tell me, I'm not on house arrest, madam, I'm on room arrest. Because they're just in one room with their laptop.
Yeah.
They can't.
Yes, yeah.
Earlier in the office, they used to work 12 hours. Now they are working 14 and 15 hours.
Yes.
So all this is playing a major role on their health. People are gaining weight. People are getting into nutritional deficiency.
Without knowing them.
Without even realizing.
Yes.
On one hand, we are worried about the COVID and all of that. But what happens to all of this?
Yes.
So it's sad, but it's true. There's got to be some way to, like I tell all patients, you try to de-stress how? Mm-hmm. You take your me time.
Okay.
Take 20 minutes, take half an hour for yourself. Not that whilst you're doing something else, you're multitasking. No. Yeah. Just take those 20 minutes for yourself.
But it is very difficult to find some time to do exercise, ma'am, because they are working from home, so it is very tough.
Yes, I do agree completely. So what I tell them how to de-stress is either hear some devotional music or some music that you like, read a book. Nowadays you have got a lot of these calming, soothing music because it's a need of the hour. Yeah. So do something that you enjoy doing for yourself. That's very important to de-stress, Yeah,
how is sleep is going to affect them?
See, if you don't have an adequate sleep pattern of at least 8 hours, okay, it's okay to sleep even 4 hours, but absolutely rested sleep.
Okay.
Like how, the pundits and all used to do. But in today's time, in modern time, if I would say a person is sleeping 6 to 8 hours, it should be good enough. Okay. Yeah. And if you don't have sleep, obviously your whole body is fatigued, it's tired, because we have become like machines. From morning to night, we are just one thing.
People also complain, ma'am, after they slept for 8 hours also. They'll say, I'm still feel like drowsy and all.
Absolutely.
So why it happens, ma'am?
That's another very good question, because many patients come to me saying this particular problem.
Even I have that doubt.
Okay. So the truth is that even after you sleep for 6 or 8 hours, lots of patients come to me saying their energy levels are low, they feel lethargic, they don't feel like getting out of the bed, leave alone exercising is way out. But I always ask them to do their D3 and B12 tests, because when they do it, it's always picked up that they are deficient in these vitamins. And when we correct these nutrition, the foundation, they start feeling better.
Doctor, what is the difference between the physiotherapy and chiropractic?
Okay, basically there
Because
are
actually they do the same.
okay.
We don't find any difference in it actually.
Yeah, basically different systems of medicines, their philosophies and their the way